Health Informatics: Reducing Health Disparities, prepared by Deborah Green and Andrea Gale Dixon. We'll focus on the role of informatics in decreasing health disparities. Health disparities and factors affecting it. Health disparities also referred to as health inequalities. These gaps are seen within the quality of healthcare across racial, ethnic, sexual orientation, and socioeconomic groups. Factors affecting health disparities are geographic location, like the rural and the urban, age, literacy, injury, violence, disability, education, and income. Healthcare reform. The healthcare delivery system was brought to the attention of the public by the Institute of Medicine. There were reports in the book published "The Error is Human: Building a Safer Healthcare System," published in 1999, that from there was a quest for a better healthcare system, and it took center stage. The reports laid out a comprehensive strategy by which the government, healthcare providers, and others can reduce preventable medical errors. Informatics Action Plan. Health information technology was seen as a tool to aid the reform process with recognition to its potential to improve the safety and efficiency of healthcare delivery. Health information technology facilitates transparency, increased engagement, personalized healthcare, and facilitate the sharing of information needed to improve the quality of care as well as decrease costs and disparities. What is health informatics? Being able to access timely, accurate, and relevant information about a healthcare situation is what health informatics is all about. As shown in this image from the CDC website, for any given healthcare threat, whether it's a threat to an individual patient or a whole population, the data available to healthcare workers leads to their ability to take prompt and effective action. Health informatics can impact all areas of healthcare process. Basic monitoring data like temperature, blood pressure, etc. becomes information that healthcare workers compare to available knowledge. A temperature of 40 degrees Celsius on an instrument implies that the patient's temperature is 40 degrees Celsius, which is interpreted through use of health knowledge as meaning that the patient has a fever. From that knowledge, a decision care can be made, specifically that clinical intervention is needed. That leads to plans and a specific course of medications or other treatments for the patient. The planned course treatment, decisions were made, medication administered, the patient temperature was reduced, the patient felt better. This end result is that patient outcome was achieved. Benefits. The key areas where health informatics improve healthcare are shown in this figure. There are 4 functions involved in health informatics: access to data, structuring of the health data into readable, standardized formats, analysis of data to access data and improve understanding, and interaction at the patient level to both generate the data and use the resulting conclusions and inferences to provide better patient care. Each of these focuses has its own challenges. The access, for instance, requires near universal acceptance of some type of electronic record-keeping system, and one that is standardized so other systems can read it, even across the country. This involves issues with patient privacy. Structure. Having a universal structure with well-defined and useful variables is another issue, particularly when many useful elements are in the free text areas of the electronic records. For example, the history of smoking may well be in a text field rather than in an area more easily identifiable. Defining a globally useful data structuring system will both be difficult but very useful. Analysis. By establishing large databases and well-defined infrastructures can promote medical research and analysis of data and thus improve the support of patient care decisions. Interactions. By allowing healthcare providers rapid access to the results of the analysis, patient care decisions and overall patient outcomes can be improved. Information systems that decrease health disparities. For instance, the nursing information system, monitoring system, radiology system, where the diagnostic tests are ordered, procedures are sent out, the patients are educated, appointments are made. The pharmacy system, which is something very important, it helps prevent and identify medication errors. Risk management, where patients at risk are identified early, so corrective from one organization to the next. Further opportunities. Predictive medicine. Using electronic health records to predict and prevent future medical problems. There are other opportunities where information can improve patient outcomes and reduce overall errors in healthcare decisions. And one of these, as mentioned, is predictive medicine. In this sense, seeing patterns of symptoms can be analyzed by the system to come up with predictions of current or future medical problems. One specific example of this would be a pattern of injury or bruising that the system would flag as a possible indication that this patient, there may be some kind of abuse issues happening. Another huge rationale for health informatics is looking at the health of populations rather than individuals. The CDC and its Division of Health Informatics and Surveillance uses this as a local, regional, national, and global basis to identify potential public health, epidemic, and pandemic situations before they get out of control. Health equity. The goal to decrease health disparities is to achieve health equity. Healthy People 2020 defines health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone's equality with focus and ongoing societal efforts, addressing and eliminating of all health disparities. Thank you for your attention. These are my references where we obtained our information from. Thank you. Bye. End of presentation.